I know every operating
At my
system like
last
the
job,
back of
in
my
my current
hand.
role,
I have
When it comes to
25 years of
IT.
experience and have worked with several people from your company. I've been recognized for my passion. My team is everything.
LinkedIn delivers candidates who rise above the rest. With an up-to-date view into shared connections, skills, and interests you won't find anywhere else. See why 86% of small businesses who post a job on LinkedIn get a qualified candidate within a day. Post a job for free at linkedin.com/achieve. LinkedIn, your next great hire is here.
You know what's smart? Enjoying a fresh gourmet meal at home that you didn't have to cook. Meet Factor, your loophole in the laws of mealtime. Chef-crafted meals delivered with a tap, ready in just 2 minutes. You know what's even smarter? Treating yourself without cheating your goals. Factor is dietitian approved, chef prepared, and you plated. Pretty smart, huh? Refresh your routine and eat smart with Factor. Learn more at factormeals.com.
You are one pathetic loser.
You get nothing. You lose. Good day, sir.
See, that's the things that are coming out of your mouth, child.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
Help if I turn my mic on. From the world famous Jake Hudson Network in beautiful downtown OJ City. It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, faux Dr. Scott. Hello, Scott. It's a man named Scott who's not a doctor. And his pal, John. Hello, John.
Hello, hello.
And Tacey's here, just giving wine out to everybody. You don't have to talk. You're fine. This is a show for people who never listen to a medical show on the radio or the internet. If you got a question, you're embarrassed to take to your regular medical provider. If you don't find an answer anywhere else, give us a call. 347-766-4323. That's 347. Take it, Scott. Boo. It's 347-Pooh-Head. Follow us on Twitter at Weird Medicine and Dr. Scott WM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Don't forget stuff.drsteve.com, stuff.drsteve.com. And if you're interested in the Roadie robotic tuner, check out Roadie, ROADIE.drsteve.com. And they also have the Roadie something else, the Roadie Coach. The Roadie Coach will teach you how to play an instrument. Check out Dr. Scott's website at simplyherbals.net. And check out our Patreon at patreon.com/weirdmedicine. I'm putting new stuff up there, all kinds of eclectic stuff. YouTube shorts go there first. Live streams, the full behind-the-scenes podcast video is on there. If Dr. Scott and I play some stupid songs, they all go there as well. And some other things. There'll be some specific live streams just for there. And it's just an archive of things. That's, Cardiff Electric had a bunch of our friends do a birthday video for me. And I felt kind of embarrassed just putting it on YouTube. But I did put it on Patreon so people could see it. So it was very sweet and nice. And so that's up there as well. And then I saw that look on your face, Stacey. I just got it, so don't freak out. And then cameo.com/weirdmedicine. If you want me to say fluid to your mama, I will absolutely do so for $5 or less. All right, very good. Don't forget Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And check me out on Normal World with Dave Landau. And we're finally, I got Andy Hines working with me from A. Hines Media. You all know him as Trucker Andy from WATP. And he's going to be helping me put together those normal world pieces so that I'm not so behind. I'm about 4 weeks behind turning in the female ejaculation one. So that's coming, but it'll air very soon now that I got Andy on the thing. So anyway, welcome to the studio, Scott and John. Why are you guys here?
I was told I'd be observing a radio show today, so now I'm in it.
Likewise.
Observing. Well, I'm going to sit here and you two guys are just going to be staring at me. That's bullshit. It's not happening. So, so listen, here's the thing. This is what Opie told me a long time ago. If you got something, kick in with it. But you don't have to try to force anything, so you're fine. So if you have medical questions or anything like that, and you have something, just raise your hand. Let me know. Or just pop in. But I will fill the silence with my own voice if you don't say something. You know what I mean? So if you want to say something, just pop in. What are you going to say, Scott?
Well, it's maybe boring, but dementia, Alzheimer's, runs in my family. I'm just curious. What are my chances?
Okay, so that's a great question. There are familial forms of dementia, but Alzheimer's itself, if it's truly Alzheimer's dementia, tends to be just sporadic. In other words, it's not a genetic thing. If your grandmother had it, it doesn't necessarily make you more likely to have it. Now, there are different types of familial dementias. So did anybody in your family ever see a geneticist or a neurologist to see?
No.
Okay. So really, a familial Alzheimer's disease is extremely rare. It's caused by a mutation in a certain gene called PSEN1, and you can be tested for that. So, and it's autosomal dominant. So if you have the disease, your children have a 50% chance of developing it.
Yeah.
So let's say you've got little d and big D as the genes, right? And let's say your parent was one of your parents was big D, meaning they had the double dose of dementia, and the other parent was little d. Then if you only need the one big D to get get the familial dementia, then every single one of their kids will get it. Because if you put that box together, this one will be big D, little d, big D, little d, big D, little d, big D, little d, right? Now, if one of the parents is little d, big D, in other words, they've got the dominant gene, but they also have the non-dominant gene, and then the other parent has none of those genes. So one is little d, big D, the other one is little d. If you put that in a 2x2 box, then you will have half of their kids will get the dementia down the road because they'll have little d, and then little d, big D, little d, big D. Okay.
Prevention?
Okay. So now prevention of Alzheimer's is something we're still working on, but they think that things like learning a new language, doing Sudoku and stuff like that can stay the ravages of dementia and maybe even delay its onset. So using your brain will have a big impact on that. And then as far as other prevention of dementia, it's making sure that your weight is under control because overweight can increase your risk of dementia. Maintaining good exercise, controlling your blood pressure, your blood sugar, all these things that we hear about that are bad for you actually increase your risk of different kinds of dementia. Limiting alcohol consumption. Stopping smoking, and then, like I said, staying mentally active and stuff, and preventing head injury. People who have traumatic brain injuries that happen over and over again can end up with a form of memory loss that looks a lot like dementia, or you can get Parkinson's disease with Lewy body dementia, those kinds of things. So basically maintaining a healthy lifestyle and not smoking are the big ways to prevent dementia. So do you do Sudoku or anything like that?
No.
Yeah, I actually picked it up. It's kind of fun. It's actually no math involved whatsoever. It's just all logic. And it's actually kind of a fun thing. And it's really fun to do on like your iPad or your phone because you don't have to scratch in with the pencil the numbers that you think it might be. You can the computer will do that for you. But anyway, yeah.
Good.
So there you go.
Thanks.
That's an excellent question.
How about some of the things to stave it off that people are talking about, like lion's mane, psilocybin,
Psilocybin, you mean?
Psilocybin,
Ooh,
I guess.
yeah.
We heard that a couple episodes ago.
Yeah, psilocybin. I don't know if there's evidence that'll forestall dementia, but lion's mane is thought to help with cognitive issues. I take it every day. It helps with mental clarity and it helps with regeneration of nerves. So, the brain is nothing but a big bundle of nerves. It kind of makes sense. It certainly has helped my peripheral neuropathy. Whether it does anything centrally, I don't know. I'm going to look real quick while I'm running my stupid mouth and see if there's any evidence on lion's mane and dementia in the medical literature. And, okay, so there is some, this is from the Alzheimer Drug Discovery Foundation, and it says that preclinical evidence and one small pilot study suggested that lion's mane may provide benefit to individuals with Alzheimer's disease. But the 2009 pilot is yet to be replicated. Part of the problem with this is how do you raise grant money from drug companies for something that is just grows in nature that you can grow in your closet in your house like I do. You can't. So what they want to do is take whatever the active molecule is and then put a methyl group here or an extra hydrogen atom here or a hydroxyl group and then turn it into something else. And then they can patent it. But they can't patent this. And if you're going to take lion's mane for its neuroprotective benefits, make sure it is lion's mane's extract. So that is dual extracted. It's extracted with alcohol and then extracted in water and then put back together. They can either dehydrate it at that point or just give it to you in a liquid. Because the fruiting body itself, like I've bought some that just said it's just lion's mane fruiting body. What they do is they dehydrate it, pulverize it, and put it in capsules. And the matrix that makes up the body of the mushroom is made out of a protein called, or actually it's, I'm guessing it's a glycoprotein. It's got sugar and protein elements called chitin. And chitin is what makes insects their shells. Their shells are made out of chitin. And it's also in these mushroom bodies. And the problem with it is you can't digest it, and it prevents you from absorbing the active ingredients in lion's mane from the mushroom. So you want to extract it. Just like psilocybin, if you eat the psilocybin mushrooms, you'll get some effect out of it, but you'll do a lot better if you convert the psilocybin to psilocin before you put it in your mouth, which people will do that with lemon juice, just any acid, and then hot water, and that'll extract it out and activate it, and it works a lot better that way. I'm just saying, not that I know, but I'm just saying, if from a scientific standpoint, it works better that way. I'm not advocating that anybody go out and eat mushrooms that they don't know what the hell they are. And don't do that. If you're a forager, you need to know what the hell you're foraging. People get sicker than shit or die every year foraging mushrooms thinking they know what they're doing. So if you don't know what you're doing, don't do it. But there is a Reddit, subreddit called Mushroom ID. And if you find a mushroom, you take pictures of the gills and the head of the thing and take pictures from a bunch of different angles and then shoot it up there to Mushroom ID on Reddit, and they'll come back right away and tell you what it is. They're real serious about it. There's also a Facebook group that if your kid eats a mushroom, you take a picture of it, you put it up there, they'll tell you if the kid needs to go to the ER or not. That's pretty cool. They're really they have amateur and professional mycologists on there for that reason, because the shit happens all the time. My sister almost killed herself. Now, my sister has this thing called Dunning-Kruger syndrome. Are you guys familiar with Dunning-Kruger at all?
No.
Okay, Dunning-Kruger is when there's a cognitive dissonance between what you know and what you think you know. So that can go both ways. It could be stupid people who think they're smart, or smart people who think they're dumb or don't think that their abilities are special. Like my kid has Dunning-Kruger, but he learned blackjack basic strategy in a weekend. Some people take months, if not years, to learn it perfectly. He learned it in a weekend, and then he's trying to teach his mother, Tacey, how to do this, and her brain doesn't work that way, and he's just getting frustrated because why can't you do this? And he doesn't realize other people can't do what he does. And then there are stupid people that think they're smarter than they are. Examples of that: my sister, the stuttering John Melendez. It's demonstrated that he has a little bit of Dunning-Kruger. So, and I'm not saying anything out of school. It's been demonstrated publicly. So. It's not necessarily a bad thing. It's just a cognitive dissonance, right? So my sister, I'm smart. I can forage for mushrooms. I know what these things are. And then she ate them and almost died. Stupid.
Okay.
Yeah. And if you go on the mushroom subreddit, or there's a bunch of them, but people go, ooh, I found this. Can I eat it? I found this. Can I eat it? It's like, do you have to just shove everything in your stupid mouth? Can you just look at something and not think, can I eat this? See, that's what the grocery store is for, you dummies. But anyway, yeah, lion's mane, great question. So the data, there is some positive data, but the jury is still out because we don't have excellent data yet. So, yeah, good one. All right. Anything else you guys have?
Yeah, how about calcium scores? I heard you talking about that the other day.
Have you done one?
I have. I did one when I was about 49.
Okay.
And had a 26.
Okay,
Obviously
that's good.
One is 0, right?
Sure, but 26 is good.
And so then, I felt like I tried to get a little healthier, stop with red meat and sugars, even did intermittent fasting.
Yep.
That helped with my stomach problems and my GERD.
Yeah, absolutely.
Exercise more. All those things, I go back 5 years later, and I'm 104.
Yeah. Well, it might have been 400 if you hadn't done all that.
Yeah. Well, so I guess there's theories that it reads the hardened,
right,
calcified stuff. And so maybe before it was floating, and because of that healthy choice lifestyle, it hardened up, which I guess is a good thing, right?
Well, you're right.
And so I guess the question I have is, should you keep going every 5 years,
Yes.
or do I know that I am now on a bad path and I just need to be as healthy as possible?
Oh no, well, you know that you need to be healthy as possible, and what the calcium score. Let's get everybody up to speed if they don't know what a calcium score is. It's just a CT scan. They'll run you between every other cycle. It takes like 3 minutes to do. And what it looks at is calcium in the coronary arteries of the heart. And then it comes up with a scale, with a 0 being none and over 400 being severe. And so 0 to 10 is minimal, 11 to 100 is mild, and then 101 to 400 is moderate. And they really start freaking out if it's over 400. That's when you go to the cardiologist and they'll do things. But what it won't show are plaques that are not calcified. So you may have had some non-calcified plaques in there, and they've just matured, and then you haven't formed any other ones. And like I said, if you hadn't done all of that, it might have been 400 at this point. There's no way to know. We can't rewind the clock and not do those things and see what your score would have been. So, someday if we can peer into alternate universes, we could find the one where John didn't do all that stuff. Right. He just drank and smoked and then see what his calcium score was. But until then, we just have to suppose. And still, that's pretty good. I was a 0 when I first did it, and then I was a 240, and I was freaking the F out. And then I did it the third time. 5 years later, the technologist told me I was like 450, and I was shitting myself. It actually turned out that when the radiologist read it, it was actually lower than my second one.
Oh, so you were able to lower your score?
Yeah, so I lowered it a little bit.
Anything like niacin, is that a good?
I do all that stuff. I do,
Statin, a good idea to stay on a statin if you're getting a bad score like that?
Statin was killing me.
Mm-hmm.
It was I was destroying my muscles. I had a thing called rhabdomyolysis, where they could detect muscle enzymes in my bloodstream that was indicative of dying skeletal muscle. And then I stopped it, but then my cholesterol went back up. So now I'm taking sort of a half dose. I take the statin once a week, sometimes twice a week, something like that. And that's been better. I don't have the muscle pain, and I'm going to see my doctor tomorrow, and we'll see if the rhabdomyolysis and the liver enzymes are back to normal. And but yeah, that would be a thing. And then I like the just the diet and exercise type things. Now, you mentioned reflux. A low carb diet particularly is great for reflux. It's the carbohydrates that seem to kill my reflux. If I eat bread or something like that, or if I eat anything sweet, within 4 hours of bedtime, I'm going to suffer that at night. But if I do salad and lean, animal protein and stick to, leafy vegetables and broccoli and stuff like that, I don't have any problem with my reflux at all. And I've cured people's reflux doing that. I've cured people's type 2 diabetes doing that. So that tells me that that is at least from a lifestyle aspect, it's a healthy diet. Nobody can tell me that a bed of fresh lettuce with, balsamic vinaigrette on it and a chicken breast on there is somehow bad. But that's a low-carb meal. When people go, oh, low-carb, they're thinking of people, big fatzos eating steak with bacon and mayonnaise and cheese and stuff. That is a low-carbohydrate diet, but that's not what we're talking about.
Not the Atkins diet, right?
That is not. Atkins would shit himself if he saw people eating like that, The original Atkins diet was green leafy vegetables, lean animal protein. So, but anyway, yeah. So your second score was 104?
Yes.
So you're at the low end of moderate.
Yeah.
So the upper end of mild. So I would you need to check it again in 5 years. And, now if it stabilizes and you get to be my age, you could probably just give it up, But you guys are young, so
yeah. And some of the other things, we in the past we talked about fish oil.
Yeah.
2 glasses of red wine a night. But I'm reading more and more that alcohol is just not good for you at all.
Correct.
And so I think people are kind of backing off that right now. 4
ounces of red wine is probably good for you. Any more than that becomes neutral, and then a lot more than that becomes detrimental.
And then the fish oil, I've heard a lot of it's rancid. And I think the last time I saw my physician, she almost was to the point where maybe you shouldn't be doing the fish oil anymore. Try to get it from natural sources.
Right. Well, the thing about fish oil, of course, was that they did a study in Norway, and people who ate more fish had fewer heart attacks and strokes, right? And so the American response to that is, well, let's just get a bunch of fish and throw them in a vat and render them down into a pill and then take the pill. But it turns out that maybe what it was they were eating more fish and less other things. So really we should just eat the fish instead of worrying about the stupid pills. But there are some benefits to fish oil. They can reduce total body inflammation. And if you have high triglycerides, it can really help. So there's actually a commercial version of fish oil that they sell as a prescription for people with high triglycerides. So it's not completely worthless. I've switched over to krill oil. I don't know why, just because it looks cooler. It's red. I don't know. But the krill are probably less infused with mercury and stuff. And so it's... and I'm taking food out of the mouths of whales, though, when I eat all the krill. But there's tons of krill to go around.
And it raises your HDL, it seems like, when I'm disciplined to take the fish oil.
Yeah.
When I go in for my blood work, I'm 60. And if I get a little lazy with it, sometimes it's down around 50.
Oh, yeah. Yeah, so, interesting. Yeah. Well, exercise is a big one on that. for increasing your HDL. And the 4 ounces of red wine with the resveratrol in it, it's supposed to increase your good cholesterol as well. But exercise is the big one. So what I used to tell people, if you just want to do lifestyle stuff, is go easy on the carbohydrates, because it's those spikes of insulin that really can cause plaques to form. And then do 4 ounces of red wine if you're a non-drinker, 4 ounces of red grape juice. Get your exercise, do soluble fiber, and if you can't get enough in your diet, just take Citracel. That'll do. And, instead of white pasta, do brown pasta. Instead of white bread, do dense brown bread, that kind of stuff. Brown rice instead of white rice. And those things all tend to help. And if you can't get it, if you've had a heart attack, you pretty much need to go on a statin for secondary prevention. But a lot of people can avoid getting on the statin if they can just get their lifestyle under control. But you can't beat genetics, though. That's the problem. Yeah.
Now, Dr. Steve, do you have an exercise regimen?
Yeah. So I sit and take popcorn and put it in my mouth. And that's my exercise. Now, I need to be doing more stuff. I need someone to do something with. That's when I was in the best shape of my life. I had a friend of mine that was a ham radio operator, and he and I would go to the gym 3 times a week, and we would compete who could, lift the most on the curling machine and stuff like that. And we got to the point where both of us could lift the max on the curling machine. And I was in unbelievable shape. I was in 4th year medical school. I've got pictures of me holding my nieces up by my guns. They're just hanging on my arms and stuff. And now you look at me now, you'd never believe it. But I needed somebody to go with me, to commit to going, and then we would compete a little bit, just a little mild competition. So I need that. I don't even get out and walk like I should. I've got a Peloton downstairs. It's a great thing to hang your clothes on and stuff, And that's the problem, And I got my nurse practitioner. I got her to buy the same model that I have. Actually, it's a Nordic track, but same type of thing as a Peloton. And I got her to get one, and we were going to compete against each other because you can compete on that thing. And she hadn't done it the first time. Spent all that money and just has never gotten on it. So that's the thing. It's a pain in the ass to exercise. I was doing it with VR for a while. I had a virtual reality exercise program, and it was great. It was fun to do, and I was doing it. And then, the statin started messing with my muscles, and then my shoulders were hurting so bad I couldn't do it anymore, because it's mostly with the VR stuff, it's moving upper body stuff. But anyway, yeah. What about you? Are you doing any exercise? Yeah, lifting the cup to your mouth. I get it.
Yeah, that's it.
Now, your daughter is doing NASCAR, right?
Well, it's a form of NASCAR. It's late model. Racing.
Okay, but she could graduate into NASCAR.
That's her goal.
We won't say her name or anything, but I really have a feeling if she sticks to it and gets on the NASCAR circuit, she'll be bigger than Danica Patrick ever thought of being. I think that she's got the personality. She got the looks. I mean, you and your wife are, extremely attractive, and you're going to only have attractive kids, And she's going to kick its ass, so.
We're hoping.
Yeah, that's cool. That's cool. That's awesome. It's if she gets on there, we got to get her in here because people will be fascinated about just how that works and how you learn how to do this and train and all that kind of stuff.
Yeah, you actually have to be in good physical shape to
do
what she does.
Does her coach make her work out and stuff? That was why I was bringing this up, actually. I was just curious about that.
He encourages it, as well as I do.
Yeah.
And also diet's very important.
Yeah.
You get dehydrated quickly in a car.
Oh, yeah. Well, you don't want to be a big fatso trying to drive a NASCAR around. You don't see too many of those.
Not too many, yeah.
Just Tony Stewart.
Is he a big one?
Yeah, he's pretty big.
I don't know him. Yeah. I mean, just strapping you in, you got to be able to strap in, and embarrassing if they can't get the seatbelt around you. Like at Dollywood or something. It's so sad seeing them kick somebody off the Tennessee Tornado because they can't get the seatbelt to go around them.
They need to get seat extensions like they have on the airplane.
Yeah. Well, speaking of Dollywood, and I've told this story before about, you guys ever been to Splash Country?
I have not.
Okay, well, it's a Dollywood theme park, water park. And they have this one area where you get these inner tubes, right? And there's a sign there. And this is just talking about the obesity problem in the South particularly. And it says double inner tubes are for an adult and a small child. Maximum weight not to exceed 500 pounds. So, if they had to put that in as a sign, they had a problem. You don't put a sign up thinking maybe you'll have a problem. You put a sign up like that because you've had issues,
problem.
Right? Yeah. So anyway, 500 pounds, an adult and a small child.
That takes a lot of air.
Yeah, it sure does. Anyway.
Hey, Fidelity. How can I remember to invest every month?
With the Fidelity app, you can choose a schedule and set up recurring investments in stocks and ETFs.
Oh, that sounds easier than I thought.
You got this.
Yeah, I do. Now, where did I put my keys?
You will find them where you left them.
Investing involves risk, including risk of loss. Fidelity Brokerage Services, LLC, member NYSE, SIPC.
All right. Well, you guys want to answer some questions?
Sure.
Number one thing, don't take advice from some asshole on the radio.
All right. Thank you, Ronnie B. Let's see here. Oh, of course. Technical. Now it'll play like 3 times. Oh, my God. Sorry, everyone.
Hey,
there
Dr.
we go.
Steve,
there
how's
we
it
go.
going?
Yeah, it's going
Great.
terrible.
So happy to hear that.
Thanks, man.
This is Rob from Fredericksburg, Virginia.
Hey, Rob.
A while back, I had called about how much weight a man has to lose, what that ratio would look like for his penis to grow an extra inch.
Right, and that is Dr. Steve's rule. It's 35 pounds. You regain 1 inch of penis length. Now, that curve is only linear for a certain part of that curve, right? Because if you weigh 800 pounds and you lose 35 pounds, your penis is still going to be enfolded in your fat pad, right?
How would you know?
Right, exactly. So this only works for, between, say, 250 and 175 pounds, something like that, okay? That's when the curve is
And I'm
linear.
curious.
Yeah.
How much weight would a woman have to lose in order for a guy to shove his big, meaty erection further into the woman's vagina?
Oh, well, I mean, who cares, right? As long as it feels good. No, I don't know. I've never developed that rule. But the thing is, the vagina doesn't change shape. And actually, the penis doesn't either. It's just enfolded in fat, the pubic fat pad. So, there aren't that many women who have so much fat around the perineum or the taint that it makes it difficult to, shove your member in there. But that's evolutionary. We're designed to make that easy. So I don't, it's just whether you would want to, I guess. Go ahead.
Now, is it possible for a man who has Peyronie's disease to satisfy a woman quickly to find that, quote, G-spot better than someone who doesn't?
Well, now, true Peyronie's can be extremely painful, but if you have a curvature in your erect penis, that's actually a good thing. Because think of it, if your penis is perfectly straight and it just goes in and out and in and out, right? But if it's curved, then when the tip goes in, it's going to hit. So let's say if the curvature is to the right, in other words, the bow is to the right, then when the tip goes in, it's going to hit the left side of the vaginal wall. Then as you insert further, then the bow will hit the right side of the vaginal wall. And then as you keep going, then the base will hit the left side again. So it increases your apparent girth if you have a curvature. Now, if you have true Peyronie's and it's bent at 90 degrees, you're not shoving that anywhere. And it hurts like hell. And go see somebody. Peyronie, and if you don't want Peyronie's, don't let the woman get on top when you've got whiskey dick. That's just your advice from your old Uncle Steve, because that's how it happens. She's on top, you're only semi-erect, and then she thrusts down, and she's not lubed up, or you're half in and half out, and it bends the penis in half, folds it in half, and that's what fractures it.
Ouch.
And when they say fracture, there's not a bone in there. What really happens is the tunic, that goes around the slightly elastic tunic that surrounds the erect shaft will actually split. And then when it heals up, it causes scar tissue and it'll always bend in the direction of the scar because it's not as elastic as the rest of it. So if you have that happen, get it checked because it can be fixed. All right? Or it can be improved. All right? Questions, comments? We good?
Should have let off with that instead of lion's mane.
Well, why would you unless you actually have that problem? So.
Okay, I don't have that problem.
Good, okay, I don't care. That's too much
Hey there,
information.
weird medicine folks.
I mean, we go on vacation together. I can't be sitting there with you at the beach and thinking about you bent up cocks.
They're weird medicine folks.
Hey, man.
This is Dave from Rhode Island.
Hey, Dave.
The trigger finger guy.
Yeah, man.
If you remember that. So listen, a couple of weeks ago, somebody had called in, had chronic back problems.
Yeah.
Decade or a couple of days. And,
Good Lord, his audio is terrible. He's calling about turmeric or turmeric or however you want to pronounce it. And we had talked about using or Dr. Scott had talked about using a natural supplement called turmeric or curcumin for back pain. And it is an anti-inflammatory. It actually is a COX-2 inhibitor, just like ibuprofen or naproxen is. So it's nothing, different. It's the same mechanism. So it will have the same problems that those things do. And recently there were a couple of articles talking about liver damage with turmeric. And it was a small but growing risk and could cause liver injury in very rare cases. These risks are higher for people who already have liver problems like hepatitis or gallbladder disease. And it's considered a drug-induced liver injury, and very often can be caused by herbal and dietary supplements, and is underreported because a lot of those folks who are taking these don't go to the doctor very often, and they don't get their blood work checked. So there's no recommended doses of turmeric. That's part of the problem. The supplement manufacturers will recommend these ranges, but they're just kind of empiric. And just make sure that you're not taking it in, like, if your doctor tells you, hey, your platelet count is low and you shouldn't be taking a non-steroidal, you probably shouldn't be taking turmeric either. But talk to them about it, okay? But that's what that's about. Okay. Sorry, man, your audio was just too bad.
Hey, Dr. Steve.
Hey, man.
Fluid Gang here.
All right,
Number
buddy.
one, your website stinks.
Yeah, I
Need
know.
some updating. Number two,
I'm completely aware, thank you.
put your phone number out there more because I searched way too long for that bullshit.
Okay, well, is it not? Okay, you mean this phone number? It's okay. I'll fix that. It's supposed to be on every one of the tags for our podcast, but I think it fell off and I never put it back on, so I will fix that. Thanks.
Number three.
Of course, we do say it at the beginning of every fucking show, so I don't know what to tell you. 347 Poohhead.
I brought this woman home from the bar who is voluptuous.
Excellent.
She has some nice fluid.
Excellent.
Anyways, I ended up eating her out.
Uh-oh.
And subsequently, the days following, my throat is sore.
Oh, no.
And I have the constant taste of pussy in my mouth. My question to you is there any reason to be concerned because she was kind of gross, and then is that normal, or is that all in my head? Thank you. I will listen off the air.
Okay, buddy. Thank you.
How much did he drink?
Yeah, he had the old beer goggles, don't you know?
It's closing time.
That's this isn't that uncommon. There's two things. If you're still tasting it, it's probably she may have had a yeast infection, and now you have thrush, and that could cause a sore throat, and it could cause that taste to persist. Having said that, you need to get checked, and someone needs to swab your throat and make sure you don't have pharyngeal chlamydia or pharyngeal gonorrhea. And if it's just thrush, they can give you some medicine to take care of it. But go get that checked. And if you don't want to go to your primary care because you think they're going to judge you, which they won't, then go to the county health department. They can test you there, and you can do it kind of anonymously. But this needs to be checked out. All right. Okay, that's all I have to say about that one. But thrush is just a yeast infection of the mouth and the throat, and that can cause sore throat, and you have a weird taste. Sometimes it's metallic. Sometimes it could even be fishy kind of taste, and then it's very easy to treat. They use liquid nystatin. You just swish it around for a week, and it's gone. But please get that checked.
Isn't that what happened to Michael Douglas?
No. Michael Douglas got head and neck cancer from eating at the Y. And that was from HPV. So HPV, particularly strain 16, it causes head and neck cancer, it causes penile cancer, it causes rectal cancer, and it causes cervical cancer. So it sucks, and it needs to be eradicated. We can pretty much eradicate it if everyone would get, or if a preponderance of people would get the Gardasil or the new HPV vaccine. And people will go, well, you're giving it to 12-year-old girls. You're encouraging them to have intercourse. It's like, no, dumbass. We're trying to catch them before they're having intercourse. Because if they've been exposed to it already, the vaccine doesn't work. So that's why they're giving the vaccine. And so for the longest time when it first came out, people were like, well, we don't have long-term data. And people were saying that there were all these adverse effects, and that was not true. And, people will report things to that vaccine database, but the vaccine database is just self-reported. You can say anything you want to on there. All that does is send a signal to the FDA, oh, maybe we should look at this closer. And then when they do, they don't see anything on this vaccine. It's a standard vaccine, not an mRNA vaccine for the people who, are nervous about that. And now we do have long-term data. And what we've seen is about a 90% decrease in abnormal pap smears and a concomitant decrease in cervical cancer. So this is amazing. Cervical cancer sucks. If you don't catch it in time, it becomes an extremely angry cancer. Stage 4 cervical cancer is generally considered to be terminal illness, and I've seen it in its late stages. It's awful. So anything we can do to prevent it is I'm cool with. What else are we preventing? Not just cervical cancer, but everybody that eats at the Y is somebody that's had, the vaccine is not going to get head and neck cancer or penile cancer or rectal cancer from that either. So we're going to be decreasing all of these cancers. We're killing 4 birds with one stone. So that's a big deal. All right. How'd we get off on that? I don't remember. Oh, you were asking about Kirk Douglas. Yeah. All right.
I think I've actually got something useful here instead of me just asking a question.
Well,
but we're going to start off with a question anyway.
Okay.
How's everybody doing?
We're doing good, thanks, buddy.
Anyway, have you ever heard of a male floor pelvic exercise?
Yes.
Or something such as that. It's essentially a men's Kegel exercise.
Yeah, sure.
And I've been doing it for a couple of weeks.
Yep, good.
We've talked about my ED on the air and Cavajet and everything else.
Yep.
But this right here, for the last 2 weeks, has been pretty much amazing.
Well, good.
I'm going to be honest and say I've seen about a 25% recovery so far in the last 2 weeks.
Wow, okay.
And essentially, if you can visualize your taint, taint your balls, taint your ass, so visualize your taint and the muscles that are there, and you physically pull those up.
Yeah. Okay. Thank you. This is my job, but you go ahead.
Figure out how to make a move. I'm sure they don't move just a couple of centimeters, but anyway, I started off doing it 10 times, holding it for 1 second. Now I'll do it 10 times, holding it for about 10 seconds.
Let's all do it.
I do it while I'm driving. I do it while I'm sitting at the desk. Nobody knows that you're doing this workout.
Oh, they know.
And I've done it in the last 2 weeks.
You
now
tell
I can
everybody.
feel it pulling muscles all the way to my hip bone.
Yeah.
So I think that this might be a possible little non-medical recovery thing.
Yeah, not non-pharmaceutical. Yeah, absolutely. Kegels, either your pelvic floor gets flabby as you get older, and women do them to tighten up those muscles and improve their continence, their urinary continence and stuff, and to reduce pelvic pain, and men can do it, to reduce pelvic congestion and stuff like that. It may be worth doing. Like he said, there's no downside to it, and you can exercise without anybody really knowing about it if you just keep your mouth shut about it.
Yeah, I'm doing Kegels right now.
I am too. See, but that's the thing. See, we're telling everybody. That's part of it. But, you want to just start gently and get the right form, and don't do them while you're wearing a Foley catheter. So you shouldn't do that when you got a Foley catheter in place, because it yanks it around. And if it hurts, stop. But other than that, exercising your pelvic floor muscle is probably pretty good for you. And there are some men that swear that if they do Kegels, that it improves their premature ejaculation. So my treatment for premature ejaculation is edging. And I mean, for real, it's edging is a real treatment for premature ejaculation. So you can take medicines and some you can take Prozac, you do all this stuff, but instead go buy one of the a Fleshlight or a gel version of the Fleshlight. And basically, what you do is instead of sitting down and jacking it up and down on your cock, you simulate intercourse with it. So you fix it to a table with your hand, or put a towel over it or whatever, and then just have intercourse with it, right? Standing up. And then when you get close to have feeling that you're gonna bust a nut, you pull your penis out and you grab the shaft with your hand, and then you put your thumb over the urethral meatus. Now, if you've gone too far, you won't be able to stop it. But if you catch it at the right moment, it will stop that feeling, and then it backs off, and then you do it again. And you keep doing that until you can have intercourse with this thing for as long as you want to without ejaculating. Now, the second part is doing it with a real human being. So you have to have a partner who is who understands your problem and is willing to help you.
Be patient. And
be patient with you, and do the exact same thing. You edge, and then when they get the feeling, then they put their hand around it and grab the end. And you keep doing that until you can have sex with them as long as you want to. And it may take weeks to months to get this, but it is absolutely something that you can train your body to do. So there you go. Or you can just take a pill. But the pill, it's great, but it doesn't, it does other things to you. This just fixes the problem at hand without taking a pill that goes to the tip of your nose and the tip of your toes just to help you not, splooge too quickly. And the definition of premature ejaculation is that you're ejaculating before you think you ought to. That's it. There's no metric for it, Okay? All right. Okie dokie. Let's see. I don't know what this is.
Hey, Dr.
Whoa.
Steve.
Yeah.
I got a question about, I had oral intercourse with a transsexual.
Oh, okay.
And
you had what kind of, did he say intercourse with a transgender person?
Oral intercourse.
Oh, oral intercourse. Okay. Now, this call is from 2015, so he may use terminology that is no longer considered genteel, but we'll just say so.
With a transsexual.
Yeah.
And it was unprotected oral.
Okay. But was this a trans male or a trans female? That's the question. And if they were a trans female, had they had bottom surgery, or, were they still, the pre-op, whatever. So we need a little more information, but maybe he'll give it to us.
Not even for very long. Anyways.
Okay.
Since then, I kind of had like a sore throat, tough time swallowing.
Oh God, this is the same. It's a different guy. This is years apart from each other. Okay, so he performed oral on this person,
and I get on occasion I'll get really localized headaches, in one certain area of my head.
Yeah,
and also I'll get dizzy from time to time.
Okay.
And I went and got tested, and even asked for them to do an oral swab.
Good.
And the results came back negative.
Okay, good.
And the symptoms persist, and I was just wondering if you might have any insight into that. Thank you.
Well, the key to this is the lightheadedness. I think he's hyperventilating. I think that I have a funny feeling this is anxiety, and he's ruminating about this, and he's having, and he may be hyperventilating and making himself dizzy. The sore throat could be coming from mouth breathing while he's hyperventilating. It could be something as simple as that. The good news is he got tested. I'm assuming they tested him for chlamydia and gonorrhea and even herpes, and all of those things came out negative. So that's almost certainly what it is. You might want to see a cognitive behavioral therapist just to work through the anxiety. 6 weeks would be all, and you just need to get it out. Now, this is from 2015. If this person is listening and you find out something different than that, give us a call back. But I'm going to guess that's what it was. You guys got any ideas?
Those guys are going to the same bar?
Yeah, no, I don't know. I mean, it is weird. It's 9 years apart and on the same show.
Hey there,
Hey.
I hope you've got a second or two. It's Tim. It's Tim.
Hey,
we
Tim.
haven't talked in quite a while, and I thought I'd leave a little message, sort of bring you up to date. I know you've been incredibly busy, and you got that operation working there and all that stuff.
What?
You don't have a lot of time to reach out and touch base with old friends. I haven't seen quite a while.
Yeah.
We used to be close, but that's all right. I'm not holding it again. I'm not calling you up to give you a big lecture. But I am going to let you know what I'm up to because I know you care and I know you want to know what the hell I'm doing. So I'm going to leave it out here on your machine. And I'll be.
This is the same guy that when Big Kev got phone calls from people from my show, because we used to share a time slot on Sirius XM. There was this Big Kev's Geek Stuff, and then there was Weird Medicine, and the phone numbers would get mixed up. People would call the wrong thing. And so this guy would call and say, yeah, I called that old Big Ken, and he kept calling him Big Ken just to fuck with him. But anyway.
Fairly decent amount of time here for me to lay down, sort of kind of bring you up to date here, where I've been coming from and what I've been doing. So, just so I don't get cut off in the middle of the sentence here, I'm going to wrap it up real quick, go straight to the chase, and then I'll fill it in with all the details after that.
And then that's it. What an asshole. What an asshole. That's a guy I went to college with, it turns out. I finally figured out who he was. What an idiot. Okay, anyway. Thank you, Dave. That's Dave Haynes, everybody.
See
Hey,
the
Dr.
one.
Steve, I was wondering if you could talk about HCG.
Yeah, go ahead. Sorry.
I was just going to ask if he's the one who's running the Ramp Festival.
No. Yeah, right. The Ramp Festival that has no ramps. I'm going to go earlier next year. I'm going to get some friggin' ramps. That really pissed me off this year. I didn't get any. However, having said that, my Tabasco crop was bumper this year, and I fermented a bunch of Tabascos and made Tabasco sauce out of it, and it's the best I've ever made. So all right. So that was. I didn't get to make ramp salt, but I have some of the best hot sauce I've ever made. All right. Let's see here. What does this guy want? We've only got a minute or two.
Hey, Dr. Steve, I was wondering if you could talk about HCG for testosterone replacement, using that as a therapy. I know it can cause the testicles to boost testosterone.
Yeah.
I've been trying it. It seems to be working. Any drawbacks on that? Thanks.
Yeah, HCG is human chorionic gonadotropin. That is a hormone that increases testosterone levels by stimulating the testicles to produce more testosterone. It acts like a hormone called luteinizing hormone, which again stimulates the testicles to produce testosterone. The nice thing about this is it can maintain sperm production. So unlike taking testosterone supplements, which shrink the testicles and shut them down, this stuff may help. But a lot of people are taking it off-label, not prescribed by a provider. If you have a problem with low testosterone, you want to maintain fertility, there is an approved drug for that called clomiphene that you can get that does the same thing. So the thing is that HCG is derived from the urine of pregnant women and animals, and it was used as a weight loss aids for a while. Remember that was HCG diet? They'd put people on 600 calories and then give them a shot of HCG and then charge $200. Well, HCG didn't do a damn thing. It was the 600-calorie diet that they lost weight on and the rest of it. So I'm not a real big fan of using HCG for this. If you really have a problem, it breaks my heart when people feel like they can't go to their healthcare provider to get help for these things, and they just sort of seek help out on the street. And there are ways that you can do this without having to go to the street. So, but that's it's okay. But like I said, I'm not the biggest fan of it. All right, so let's do a couple more questions. Here's one on the carnivore diet. It's apropos to what you brought up earlier, John.
I started trying to do the carnivore diet.
Yes.
Where it's supposedly just meat and everything.
Well.
But I have a serious question about that. Okay, I can understand the whole no carbs.
Yeah.
And I feel better and trying to improve my mental clarity by reducing the carbs. But I don't think that meat itself has a whole lot of fiber and
Correct.
a lot of the things that most of the vegetables would have vitamin-wise.
Right.
So
there's no vitamin C in
steak.
steak.
6 hard-boiled eggs, and then lunch is, a hamburger with no bread, something such as that. Then at night, tell me if this sounds right, a 80-20 split, 80% either salmon or meat, and then 20% veggies, broccoli, things such as that. Just take
Give thyself a
onions
bell.
or root veggies that have lots of sugar based in them.
Right.
Let me know what you think.
No, I agree.
Bye, folks.
Yeah. Animal or some sort of protein. It can be vegetable protein. Doesn't have to be animal protein. And something with fiber that, vitamin C, minerals that are not found in meat. There's no vitamin C in meat. And, a lot of other things that we need you can't just get from eating meat. We are not carnivores. We are omnivores. We have sharp incisors. They're not real sharp, but they're there. And we have grinding teeth, too. So, herbivores have grinding teeth. Carnivores have sharp teeth like cats and dogs and stuff like that. And we have both. So we were designed, whatever, that's a bad word, but you know what I mean. We evolved to be in an environment where we could make use of lots of things in our environment. So we could eat meat. We could digest a lot of vegetable stuff. We can't digest grass and things like that are just, pure cellulose. We can't digest that. But most everything else we can. So we could make use of whatever was in our environment. And then when agriculture happened, we could grow our own and we could have animal husbandry and all that stuff. And then, now you got civilization going. So that's why I think eating just one thing to the exclusion of other things is never that good, because we were designed to eat a varied diet. But you can get by with a purely plant-based diet because you can get protein and you can get all the other stuff that we need to build muscle from plants, but we can't get vitamin C and all that other stuff from just meat. Okay? So, yeah, I like the 80-20 split. That's fine. All right, and we'll do one more, and then we'll get to the super chats and stuff.
Hello, Fluid family.
Oh, this is the Stacy Show.
I
Good
hope
Lord.
everybody's doing good today.
Hey, thanks, buddy.
Got a silly little question here for you.
Yep.
Is it possible or probable that your pinky toe can auto-amputate itself?
Sure. Well, that's
because of
redundant.
diabetes or other reasons?
Department of Redundancy Department. Auto-amputate itself. It's auto-amputate means it's amputating itself. But anyway, that's now I'm sounding like
Pop
stuttering.
that little thing off. This little piggy went to market.
Yeah. So, yes, I've seen it multiple times. People with very poor circulation can get gangrene of the toes because basically the toes are bumfuck Egypt to the body. They're as far away from the source of vitality that they can get, right? And they have very poor blood supply at the best of times. That's why fungi can take residence under your toenails, because you just can't get good blood supply there, and the immune system is pretty shoddy in that area as well. So if they have really bad blood supply to those toes, they can die. And then you get somebody in the office, they come in, they've got a black toe and it's all dried out, they have dry gangrene. Sometimes you can just go over there and go click like that and just snap it right off. Yeah. There's another disease where people have inflammation of the capillaries in the fingers, and those will cause the tips of the fingers to die, and sometimes the whole fingers, and those will just snap off as well. And they heal up, and then they're kind of fine, and there's no pain when that happens. There's pain while it's happening, but then when it gets so far that it's just bone with a little bit of sinew, attached to it, and it just snaps off, there's zero pain with that. So yeah, absolutely. That can happen. It's called autoamputation. All right. So let's see here. If anybody has left a question in the waiting room, I can't see it because Dr. Scott is supposed to be following that, but I can see the super chat. So Radish, thank you for the $2. Says, I've got the little D here. Who's got the big one? I don't know what the hell he's talking. Oh, big D, little D. Okay, I got it. Yep. I heard you have the little D, Radish. I can't remember who told me that. And Dang Lizard, thank you for the 10 euros. Goodness gracious. So Radish doesn't feel embarrassed. Just kidding. Love the show. Have a great time. So yeah, he was trying to make Radish feel better about having a little D. Radish, thanks for the 6.22 euros. And he says, whoops. I don't. And then Radish again, thanks for another 6.23 euros. Says, sorry, Dang, I feel your pain. Pinky toe is the worst. So thank you all for those super chats. And all you have to do is go to youtube.com/@weirdmedicine, click join, and click accept gifted memberships. And Myrtle sometimes gets in there and gives away 20 memberships because she likes to have a hootenanny. And and other people will give gifted memberships as well. And then I do put out some stuff for members only. And it hits, if I put anything on YouTube now, it goes members only first, and then 3 days later, it goes to the public. Okay? All right, very good. Well, thank you all. And I want to say thank you to John and Dr. Scott. And Tacey just walked in with a bottle of wine for these two, so thank you, Tacey. Thanks to everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.